Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Susan Kane and Ashley LeBeau, who are the administrator and assistant administrator of Hillcrest Commons here in Pittsfield. Welcome.
Thank you. Thank you.
Thank you both for being here. Our topic today is a discussion around the valuable work done by certified nursing assistants, or CNAs. Last month, June 16th, was National Career Certified Nursing Assistant Day, and CNA Week was June 16th through June 23rd. So, Susan, I'd like to start by asking you to describe what a certified nursing assistant is and what kind of duties they perform.
Well, the certified nursing assistant is a caregiver that provides specific direct care to our residents. And in particular, in the field, we talk about the activities of daily living, which consist of eating, bathing, dressing, grooming, and toileting. So whatever need a particular resident has with any assistance for any of those areas, the certified nursing assistant provides that direct care. They spend more time with the resident than any other healthcare provider, in fact, and so they know them better than the others.
So the time that they spend with them, just because of the type of duties that they're performing, is very valuable time and valuable for the relationship between the staff and the residents, sounds like. What specific types of duties are CNAs doing, and do they vary by shift?
They do vary by shift, and residents, as we have our own habits of getting up in the morning, having our meals or taking our meals at particular times, or any of those habits, really fall to that cycle of care for the certified nursing assistant. So certainly evening usually is bedtime, and so those activities happen around bedtime. Certainly bathing occurs usually in the morning, but for some people the preference is evening. So there is a mix of what a CNA does, but it's based on resident preference.
And that's important, that resident preference for the resident-centered care that I know especially Hillcrest tries to provide. And I would imagine, too, that the duties of CNAs would vary by the type of population that they're working with as well.
Absolutely. We have a varying level of residents in our facility, and some residents are very independent and able to ambulate on their own and really are high functioning, whereas others truly depend on our staff and our CNAs to help with their activities of daily living, bathing, dressing, grooming, feeding.
So Ashley, what would a typical day look like for a CNA?
A typical day is really a misnomer. A typical day, CNAs don't really ever know what to expect. It depends on what their residents are feeling that day. It depends on what activities are happening throughout the facility. CNAs are responsible for providing the care that their residents are requesting. So they'll help the residents wake up in the morning and help get ready for breakfast and participate in activities and lunch and get to appointments. So there's a varying level of activities throughout any given day.
So no 2 days are ever the same, probably?
No, not often.
So, Susan, I've heard you talk before about how CNAs walk a fine line between coaching and the caregiving that they're doing, but also encouraging independence for the residents. So can you talk a little bit about that?
I'd be happy to. Our goal in long-term care is to encourage residents to meet their highest level of function. So while it's easy as a caregiver to do everything for a resident, what's most important for that resident is to assist them in whatever they need to be as independent. So, so cueing is a very big part of what a CNA does. It takes a lot of patience, and because we cue people to perhaps eat something, so it might be around meals, it might be around grooming independently and those kind of things, so that they can raise the level of function. So it is a fine line, but it's a very important line.
Yeah. And Ashley, how would you describe how CNAs help your residents with their overall quality of life?
CNAs, by learning their residents' likes and dislikes and their preferences specific to each resident, our CNAs are able to help our residents enjoy a life as similar to the one that they enjoyed at home while at the facility. The goal of our CNAs is to truly help our residents feel as at home as possible in the comfort of their own home, as for many residents, Hillcrest is their home. For some, they're with us for a short stay, and even our short stay residents, our CNAs help our short stay residents enjoy a quality of life similar to that they would enjoy at home.
That they had at home, yeah. And so how, I mean, given everything that CNAs do for the residents especially, how valuable is it, can you even say how valuable CNAs are to Hillcrest Commons and to Berkshire Healthcare as a whole?
I would say that while every position in healthcare and at our Hillcrest team is critically important to deliver the care and services, there is not a more important role than that of the certified nursing assistant, who is at the bedside, who does develop a trusting, caring relationship with their residents, and because of the amount of time that they spend with the residents, are the ones who often pick up on subtle changes, changes in condition, or knowing that someone is appearing different today than they usually do, which is very, very important. In fact, we have engaged at Berkshire Healthcare in a program called Interact 2, which relies upon that direct care worker to notice those changes, report immediately. Goal of it is to get the information to the nurse, who responds in a rapid fashion to the doctor or another setting, so that we pick up earlier on, perhaps eliminating a visit to the hospital, an admission to the hospital. So that's been a huge program, and one that we're refining. So we're real pleased about that, and the CNA is key to that.
And it sounds like having empowered CNAs who are able to notice those changes and who are also engaged in their work is important. How do you, Ashley, how do you keep CNAs engaged? I know they often perform a lot of difficult tasks.
In order to keep CNAs engaged, we really help CNAs know their value and their contributions, the value of the knowledge, the value of their relationships with the CNAs, with the residents. Their information that they have available to them is something that we would never have access to. So consistently asking for feedback from our CNAs, and incorporating CNAs on teams in particular. If we have a certain project team that we're working on, bringing the CNAs onto those teams to help provide feedback and to help provide the solutions to some changes that we need to make. We're constantly looking at how we can do things better and differently, so our CNAs are the solution to the future, really.
That's great. That's great. In Berkshire Healthcare, we have implemented a culture change initiative called Leading Positive Change, which seeks to provide leadership training to help our employees grow as leaders. And so how has that initiative changed responsibilities for CNAs?
I would say that most critically, it's changed for a CNA because we're now asking for their best thinking, and we are engaging them with regard to direct care of their own assignment of residents, but also on the best way to accomplish things, because we're going directly to them. They're the direct care provider, and they are the ones that know how to do things the best in many cases.
And like you said, they know the residents best.
They do.
Yeah. So have there any specific changes at Hillcrest that have come about because of leading positive change that the CNAs have been involved with?
We're pretty excited. There are a couple of project teams that are going on, and the one that we're currently involved with is a 30-day rehospitalization project. We actually have one of our CNAs from Hillcrest that's part of that team. There are 9 members on that team from our whole organization, and it's very important in terms of assessing how rehospitalizations occur and why they're occurring and how we can do better to have them part of that team. So we're really, really excited about that. And then there's the influencer.
Yes, we also have a team that we refer to as the Service Mix Influencer team, and we have a large group of CNAs at the facility who are very much leaders in their own respect. They're respected by their peers. They have great communication skills. They're looking to really make positive change for the facility and for healthcare overall. So we've identified those CNAs and brought them into some of our meetings that we've been discussing how we can change and do things differently, and having those service mix influencers on a team with us has been extremely valuable and very, very exciting.
So it sounds like the culture is changing, or has changed at least at Hillcrest. Yes. Yeah. What do you look for when you're interviewing potential CNAs?
I think one of the first things we look for is potential employees that meet our core values. That is one of the first and foremost characteristics that we look for. So CNAs have to have integrity, they have to be compassionate, they have to strive toward excellence, they have to be a team player, and stewardship all come into play. They're extremely important to our culture and the direction that we're going in. So that's what I would look for first and foremost out of a potential CNA.
And Susan, what about you? What do you look for when you're interviewing CNAs?
I think the compassion that is critically important, an ability to connect with the resident, and often, you know, a story to tell about what has drawn a CNA to the position. What is it for you that made you decide you wanted to be a CNA? That really is a great eye-opener for us, and we hear some really passionate and some really moving stories about why people decided to do the job.
I think an important, and it speaks to what you're talking about, the relationships. It's all about relationships in our field, and our CNA's ability to form relationships with the residents and the families that they're working with is key to quality of life.
And quality of care, too.
Yes, absolutely.
Well, thank you both very much for being here today. And we're going to take a short break. We're going to watch a video on Hillcrest Commons, and then we'll be back.
Nestled between the woods of beautiful Burbank Park and the banks of picturesque Onoda Lake, in the heart of the Berkshires in western Massachusetts, Hillcrest Commons is just minutes from downtown Pittsfield, in the heart of the culturally rich Berkshire County. Hillcrest Commons Nursing and Rehabilitation Center offers you the best of both worlds. It's a locally run facility, staffed by dedicated healthcare professionals from the central Berkshire area. And it's backed by the expertise and resources of Berkshire Healthcare, the largest nonprofit long-term care provider in the area. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hillcrest Commons is a proud recipient of the American Healthcare Association's National Quality Award. The Quality Awards recognize members' commitment to performance excellence by continuously demonstrating ever-improving value to residents and other customers. The Bronze, Silver, and Gold Awards recognize overall organizational effectiveness and capabilities and champion organizational and personal learning. At Hillcrest Commons, we pride ourselves on our deep commitment to our community. We offer a broad range of nursing home services, including short-term rehabilitation, skilled nursing, long-term care, hospice, and respite care services. In addition, we also offer more specialized services, including a fully dedicated Alzheimer's unit, a geri-psych behavioral unit, pulmonary and ventilator-dependent care and therapy, and a full bariatric weight loss program. We proudly offer an elegant, home-like setting that allows our residents the comforts they expect while providing the care they need, including fine dining in our graciously appointed dining room, beautiful outdoor space, ample activities, and private family space. At the heart of it all is a focus on the body, mind, and spirit. Our rehab services include physical, occupational, and speech therapy. Our licensed therapy professionals help restore and maintain the body by focusing on helping our residents improve strength and mobility in order to participate in the activities they most enjoy. These services are provided up to 7 days a week when ordered by a physician. Hillcrest Commons is more than a place to live. It's a place to enjoy each day to the fullest. Our activities program focuses on the mind and spirit of our residents by offering engaging leisure and recreational activities, arts and crafts, music, discussion groups, exercise sessions, religious services, and cultural community outings and more. Each resident and patient at Hillcrest Commons receives the highest quality care delivered by our dedicated staff members working as a team. From the nursing staff to our front office personnel, everyone is enthusiastic about the role he or she plays in the lives of the people who entrust us with their care. Our staff is committed to providing compassionate care, using teamwork as their guiding principle. We're dedicated to treating each person with dignity, recognizing their individual needs, goals, and preferences. We create a care plan for each person, focused on helping them achieve the highest level of independence and quality of life. At Hillcrest Commons Nursing and Rehabilitation Center, we're perfecting the art of superior care. If you or a loved one need short-term rehab, extra care after a hospital stay, or a nursing-supervised full-time living arrangement, we invite you to tour and meet our staff. See firsthand how we enhance the lives of those we serve. To make arrangements or get more information, call 413-445-2300. We look forward to meeting you.
Welcome back. I am honored to be here with two certified nursing assistants from Hillcrest Commons. We have Amanda DeSormo and Michael Quinones. Welcome both.
Thank you.
Thank you for being here today. So we just heard a lot from Susan and Ashley about what CNAs typically do, what your jobs look like. And I'd like to start by asking you each how long you've been CNAs. So Amanda, how long have you been a CNA?
About 3 years.
And what about you, Michael?
24 years.
24 years, that's great. So Michael, what does your typical day look like? I know Ashley said there is no typical day, but what does your job look like?
She's correct, there is no typical day, every day is different.
Yeah.
But if you approach it the same way as you do with caring and compassion, everything works out fine.
So Amanda, what would you say when you come to work? Would you walk through just what you would be doing maybe on a typical day, on a Monday, for example?
Well, the day of the week doesn't really make a difference, but you start by getting a report from the previous shift so you know if there's been any dramatic changes with your residents, and so you know how to take care of them because of that. There's always assessing the safety of the residents at the change of the shift is very important, and you have to determine what your residents' needs, and so you can assess, meet those needs before their next meal time, and hopefully take care of them as best as possible.
And Michael, I understand that you do a lot of work to mentor new CNAs. How do you bring people into Hillcrest when they start their job? How do you explain to them what CNA work would look like at Hillcrest especially?
Well, I like to mentor the CNAs because I like for them to get a feel of what Hillcrest does. And I also like to, for them, I would like to say, get it right the first time, the way I see it. Which is safety. Safety comes first, and then everything else falls into place. So I just like for them to know that it's very important for safety and to know your residents. And then from there, everything else falls into place.
And Michael, you and I were talking beforehand about what makes a good CNA, and you said there's one word.
One word, caring.
Caring.
You have to be a person who cares. If you care about the resident, everything else falls into place. You care how they look, you care how they're presented, you care how what type of day they're having. It starts with caring. That's it.
And Michael, can you, we had heard a little bit from Susan and Ashley about some of the different project teams that are happening at Hillcrest. I know you're working on the 30-day rehospitalization project. Can you talk a little bit about your work on the committee?
Well, actually, I'm very, very pleased that I was approached to do that, because us as CNAs, we don't get to see that aspect. All that entails to have someone admitted into the facility. We just see them there and that's it. We don't know what a tenuous task it is to have someone there. So I was very pleased to be asked. I've followed a lot of knowledge that I've received, and them being able to get my input makes me feel like I'm important.
Right, because you are.
To the whole project.
Right.
And that's changed in the years. In some years, our CNAs didn't have that feeling that we were important at all.
So tell me then, how has the work of a CNA changed over the past 24 years?
Well, basically, when we first started, I first started as a CNA, we didn't feel like really much part of the team. You know, we had a job to do and that was it. I feel that now, through the years, we are more important. We do the more direct care. The nurses, the doctors come to us to see if there's anything wrong with a resident that we will only probably pick up on. And that's changed a lot through the years. We were just not that involved through the years before.
And Amanda, I know you're doing some work on some of the project teams too. Can you tell me about some of the work that you're doing to influence customer service? I know we had talked a little bit about advocating for the needs of the residents around documentation and that sort of thing.
Yeah, by documenting everything that we do for the residents, we're able to see the changes in the amount of care that they need. So by having that information, it just opens up more opportunities to be able to properly take care of our residents and assessing and making sure that they know, or we know exactly what they need and how that's changed. It also helps make everything smoother for the staff members to be able to take care of the residents, which also makes it easier for the residents to be taken care of. So it's just advocating to make sure that everything gets done properly.
So Amanda, I wanted to talk to you about how you became a CNA and how you got into the work and what your career plans are, because I have to tell you, we were talking about this before, and when you start to talk about your work, you just light up. And you too, Michael, I mean, you can really tell that you both care about the residents. So can you tell me about how you got into being a CNA and what your career plans are?
All right, I became a CNA when I was 17 after I'd already been working for Hillcrest for about a year. And when I started there, it was honestly, I just needed a job and I did not want to work at McDonald's or the local grocery store. And my mom had worked at Hillcrest, so I begrudgingly got a job at the same place as my mom, and I was insistent that I would not like it because I did not want anything to do with what my mom was doing with her life. So time passed and I fell in love with my job. I just absolutely love it, and I couldn't imagine doing anything else. So as I graduated high school, I made my mind up, and I'm going to the University of Massachusetts to get my bachelor's degree in nursing. And I hope that nursing really is the thing for me and that I'll stick to it for the rest of my life.
Something tells me you will.
Thank you.
And how about you, Michael? How did you get into being a CNA?
I didn't start the typical way. I helped my mother take care of my grandmother. And that's how I started. I was about 14, 15 years old. And really liked the feeling that I had from doing that, and decided that's what I was going to do. So when I turned 18, that's what I really did, and I've been doing it ever since. I really love my job. It gives me a good feeling when I go home, especially when a family member or residents will say to me, you know, that person looks really good, my mother and father looks really good, thank you. You've made a difference today, which I do get that a lot, and it makes you feel good. It makes you feel like you've done something.
Is that the best part of your job?
That is the best part of my job. Having someone say to me, my mother and father looks great today, it just, nothing could ruin my day after that. Nothing.
What about you, Amanda? What's your favorite part of the job?
I just enjoy the interactions with the residents, because sometimes I could go into work and I'd be having a bad day, but then, you know, the first thing is like, oh, I need you, I have to have you, I don't want anybody else. And that's just like, you know, your day is made if you're the one that's being requested for specifically. And the interactions you have are always different, so you never know what to expect, and it's a great feeling.
That's great. That's great. Well, thank you both very much for being
Thank you
today.
for having us here.
You have noble work. You really do. Thank you.
Thank you.
So great. This has been InfoSource, a presentation of Berkshire Healthcare Systems.